Hi, this is Dr. Prasad Kaspekar, Director of Sarvasva Health and a practicing surgical oncologist in Mumbai. The purpose of this video is to talk about breast cancer. I intend to give you a simplified view of what is breast cancer, what are the various treatment options, and to highlight your journey right from diagnosis to treatment of breast cancer such that you have a complete overview of the disease. So if you or someone you know is suffering from breast cancer, then please watch this video and please share this video so that multiple people can have an insight into breast cancer and may derive benefit from it. So basically the breast is a simple modified sweat gland which is located in the front part of your chest. Both men and women have breasts. Only in women, due to the actions of the hormones estrogen and progesterone, they are developed further and result in the breasts that we see in women. Cancer can occur both in men and women, though 99% of breast cancer patients are women. But you being a man are not exempt from breast cancer. So you also should be aware about breast cancer. So the causative factors for breast cancer are mainly twofold. The first one being genetic, where due to genetic problems, the person is at an increased risk of developing breast cancer. You might have heard of the genes or testing of BRCA1, which is BRCA1, and BRCA2, which is BRCA2. So you can Google about that information for yourself, or I will give you a further video about that later. The second cause is usually an imbalance in your hormonal levels. It is seen that breast cancer is more common in women who are having hormonal issues. Those who have had an early menarche or a late menopause or have children at a late age, due to the increased level of estrogens in your blood, these people are more susceptible for developing breast cancer. An interesting study has also shown that women who have children after the age of 35 are at an increased risk of developing breast cancer as compared to women who have had no children at all. Hence, because breast cancer is seen more in women who are celibates, for that reason it is also known as nun's disease. Breast cancer is also more common in women who are taking hormone replacement therapy. So please take your medicines carefully. The signs and symptoms of breast cancer. The most common signs or symptom of breast cancer is a lump in one of your breasts. This lump is usually painless, usually very innocuous, and just incidentally detected many a times. Another symptom can be nipple discharge. If there is any discharge from a nipple, especially if it's from only one nipple, or it is blood stained, then this can be a precursor to breast cancer. Presence of ulcerations or sores in the breasts which are not healing or have no explainable cause can also be one of the risk factors for breast cancer. Sometimes breast cancer can present as a lump in your axilla or your armpit. So be sure that any lump in those regions also you get them tested properly. Breast cancer can sometimes even present as an inversion of your nipple, where your nipple does not protrude out like normal people, or there is a change in your nipple size and shape. There can also be a change in the shape of your breast or in the mobility or movement of your breast. These symptoms have to be taken carefully, and if you have these symptoms, please go and consult someone. So now, once your diagnosis has been made, and now we have to first decipher what the stage of your cancer is. Treatments are usually done based on that stage. Stage 1 is when the cancer is just limited to the breast as a very small disease, maybe less than 2 centimeters. Stage 2 is when the disease is slightly more, maybe bigger than 2 centimeters in size, or it has spread to your axillary lymph nodes. Stage 3 is when the disease has progressed even further, involving the skin, involving the chest wall, or the nodes have become enlarged to such an extent that surgery might be difficult. And stage 4 is the last stage where cancer has spread to the entire body. That stage, usually surgery options are limited. Stage 1, the options for surgery usually is in the form of something known as lumpectomy or breast conservation surgery. In that, what we tend to do is we remove the disease only with keeping the rest of the breast in normal situation. With that, we do something known as a sentinel lymph node biopsy. Sentinel lymph node biopsy is basically when we inject dye over the tumor site. That dye is picked up by the lymphatics of the breast, and that goes into the axilla. The first auxiliary node which picks up this dye is known as the sentinel node, and in that situation we surgically excise that node and send it for testing. If that node is negative, then that means the cancer has most likely not spread to the axilla, and we do not need to do an axillary lymph node dissection. When we do breast cancer surgery or lumpectomy, there are a lot of options for treatment. I will go into the surgical nuances later. Stage 2 is when the disease has spread to the axilla or it's larger in size. In these situations, we usually do the BCS surgery or breast conservative surgery, or sometimes if the disease is large or the spread is extensive, then we do an entire breast removal, which is known as an MRM or modified radical mastectomy. Stage 3, the cancers have progressed even further. So sometimes what we do is known as we give chemotherapy first, followed by surgery and followed by further treatments. This chemotherapy prior to surgery is known as neoadjuvant chemotherapy. This is something that is done to reduce the size of the tumor such that surgery is made more easy. This helps in surgery as well as reduces the tumor burden. This is what we call as downstaging of the tumor. Stage 4 is when the tumor has spread to the rest of the body sites. In early stage 4, sometimes surgery can still be done after chemotherapy. So hence, stage 4 need not always mean that treatment options are limited. But however, in stage 4, chemotherapy, hormonal therapy and immunotherapy play a bigger role as compared to the first 3 stages. So now we have sort of got a very brief insight into the treatment stages wise and how they are slightly different from each other. To further continue on this topic, please stay tuned for the next part,